Welcome back, everyone. Ready to dive into another pile of research.
Always.
Today, we're looking at preschool assessment, which, as you know, is kind of a hot topic these days.
Yeah.
And we've got some interesting research here, digging into all the different aspects of evaluating young learners. I mean,
Right.
there's the cultural considerations, the impact of a child's environment, and
It's complex for sure.
it really is. So let's jump right in. One of the first things that struck me was this idea that preschool assessment is about so much more than just standardized tests.
Yeah, absolutely. I think we're moving away from that narrow focus on just tests.
It does feel like reducing a child's potential down to a single test score is,
Yeah, I mean, you're kind of
limiting.
limiting. Yeah, exactly. We're starting to recognize that it shouldn't just be about, identifying deficits.
Right.
It's about understanding the whole child.
Their strengths, their challenges.
Yeah, and the context in which they're developing.
So it's not just about what they know, but how they learn and all those other factors at play.
That's it.
This FAF thing, the Family Assessment of Academic Behavior,
Oh, yeah, that's a great example.
that seems to really embody this approach.
It really does. It takes into account both the home and the school environments to see how they're impacting the child's behavior.
So like a kid struggling with separation anxiety at school, you could look at.
Yeah. You could look at the family's cultural beliefs about independence, maybe the child's previous experiences with caregivers, even the emotional climate of the classroom.
Wow, so it's really looking at the bigger picture.
Exactly. It helps us see the child as part of a system instead of in isolation.
Okay, that makes a lot of sense.
And it can lead to more effective interventions, right? Because you're addressing the root causes of a challenge.
Instead of just treating the symptoms.
Exactly.
Now let's talk about standardized testing, because there seems to be a lot of debate about whether those are even appropriate for preschoolers.
Yeah, there's a lot of skepticism among educators about whether standardized tests really capture a child's abilities at such a young age.
Yeah, I mean, development at this age is so rapid and so
All right.
varied. Like one kid might be amazing at puzzles and another is, super social.
Yeah.
How do you capture all of that in a standardized test?
It's tricky. I mean, one of the big concerns is that standardized tests don't always account for different learning styles and developmental patterns.
Right.
They often rely on limited samples of behavior or, they might present tasks that are unfamiliar to the child.
And that could be especially misleading for kids from different cultural backgrounds.
Absolutely.
So a child might score poorly, not because they lack ability, but because the test just doesn't match their way of learning.
Exactly.
Or their cultural experiences.
Right, and that can have serious consequences.
Yeah, because then a child could be mislabeled or...
Yeah, mislabel. They might miss out on support or enrichment because of that.
That's a huge concern. So we really need to be careful about how we use these tests with little kids.
We do. It's important to remember that they're just one piece of the puzzle.
Right.
They can give us some useful information, but they should never be used in isolation.
Or as the sole basis for making decisions about a child's education.
Right.
Okay, so it sounds like we need a more balanced approach.
I think so.
And speaking of balance, our research mentioned two main types of tests, norm-referenced and criterion-referenced. Can you break those down for us?
Sure. So norm reference tests, or NRTs, they compare a child's performance to a large group of other children the same age.
So you might know that a child is below average, but
Right.
you don't know why.
You don't know the reason.
It could be they had a bad day or just didn't understand the instructions.
Exactly. Now, criterion reference tests, or CRTs, they focus on whether a child has mastered specific skills.
Like, can they identify the letters of the alphabet or count to 10?
Exactly. So CRTs give you more specific information about what a child knows and can do.
But the downside is they might not cover every essential skill.
Right, particularly in areas like social-emotional development, which are harder to measure with a standardized test.
So it sounds like the best approach is to use a mix of these methods,
Yeah.
NRTs and CRTs, along with other information like observations and interviews with parents.
That's right. That way you're getting a more complete picture of the child's strengths and needs.
And you can make more informed decisions about how to best support their learning.
Exactly.
Now, this reminds me of something else that was highlighted in our research, the importance of observation.
Oh, yeah. Just watching a child play can tell you so much.
It really is. There's a scale mentioned called the Howe's Peer Play Scale.
Right.
And it looks at the developmental sequences in children's social play.
Yeah, and those sequences can actually vary depending on the childcare setting.
That's fascinating. So, like, children in higher quality settings might engage in more complex forms of play.
Yeah, it really highlights how much a child's environment can impact their development.
It's amazing how something as seemingly simple as the quality of a childcare setting can have such a big impact on how children interact with each other.
It really is.
So again, we're seeing how we can't just assess the child in isolation. We have to think about the context.
Absolutely. And speaking of context, let's talk about language development.
Okay. Language is so foundational for everything
It
else.
really
I
is.
mean, between 2 and 3 years old, there's that incredible burst of vocabulary.
Right. It's amazing to watch.
It really is, but of course it's not always straightforward.
No, it's not.
And our research delves into some of the complexities of language disorders,
Yeah.
explaining that it's not always just about a child not speaking at all.
Right.
Sometimes it's more about subtle difficulties with understanding social cues in conversations or, expressing their thoughts clearly.
Yeah, and those more subtle difficulties can be easily missed if we're not really paying attention.
So we need a variety of assessment methods when evaluating language development.
Absolutely.
Observations, parent interviews, specialized language assessments.
We need the whole picture to know if a child is on track or if they need more support.
And it's not just about identifying problems either. It's about how we create environments that support language for all children,
That's right. Creating language-rich environments is key.
both at home and in the classroom.
Yeah. Talking to kids frequently, reading to them, singing songs, giving them lots of opportunities to practice their language skills.
And even being mindful of the language we use around them.
Right.
Like, I know I've been guilty of using baby talk.
Yeah, but we should really be talking to them in complete sentences, even when they're really young.
Right, using a rich vocabulary.
Exactly. The more exposure they have to language, the better.
So there's a lot we can do to encourage language development even before they start school.
There really is. And those early years are just so critical.
They are. Okay, before we move on, I want to touch on something that I found really important. Cultural sensitivity.
Oh yeah, that's essential.
The research emphasized how important it is to really understand a child's cultural background when you're doing these assessments.
Yeah.
What might be seen as a problem in one culture could be totally normal in another.
Exactly. For instance, in some cultures, it's considered disrespectful for a child to make direct eye contact with an adult.
But in a Western school, that could be seen as like shyness or withdrawal.
Right. So if we don't understand these differences, we could easily misinterpret a child's behavior.
And make the wrong judgment about their abilities.
Exactly.
So assessors really need to be deeply familiar with the cultural norms of the families they're working with.
They do. And they need to be aware of their own biases, too.
Right.
It's crucial to involve families in the assessment process, too.
Asking them about their concerns about their child's development.
Yeah. And about their cultural beliefs about learning.
So again, I'm hearing this theme of collaboration.
Yeah,
Effective assessment requires a team effort.
it really does. Families, educators, specialists, all working together.
And this brings us to another shift. We're seeing this move toward a more empowering approach for families.
Yeah.
This is the parent empowerment model, right?
That's right. Instead of trying to fix deficits in the child, the focus shifts to supporting the whole family.
It acknowledges that parents are the experts on their children
Absolutely.
and that their perspectives are critical.
So instead of telling parents what to do, professionals are more like facilitators, helping families figure out their needs and access resources.
It's about building partnerships with families, respecting their knowledge, and empowering them to take an active role in their child's development.
Exactly.
That's great. It's much more respectful than the old way of doing things.
Yeah.
Okay, we've covered so much already.
We have.
I think this is a good place to pause.
Okay.
We'll continue this discussion in part 2 of this deep dive.
Sounds good.
So we've been talking about how important it is to look at the whole child, right? Their environment, their culture, their family, all of that.
Yeah, it's a big shift from just thinking about assessment as a way to label kids.
Right. It's about understanding what's helping or hindering their progress.
Exactly. And one thing that really came out of the research is how important it is to pay attention to the process of learning.
Not just the outcome, like not just whether they got the right answer.
Right. We want to see how they got there. What were their strategies? What were they thinking?
So like observe their problem solving, their reasoning skills.
Yeah. Their creativity, how they use what they know in different situations.
It's about seeing how their minds work, not just a test score.
Exactly. And to do that, you got to use lots of different ways to assess them. Observations, talking to them, looking at their work.
It seems like a much more interesting way to do assessment.
It is. And it gives you such a better understanding of how each kid learns best.
Our deep dive also talked about how crucial early intervention is, especially when it comes to language.
Definitely. The earlier you can address language difficulties, the better.
Because those preschool years are so important for language development.
They are. And we know that having good language skills sets kids up for success later on.
In school and just in life.
Exactly. They can communicate better, follow instructions, think in more complex ways.
So what does good early intervention for language look like?
Well, it depends on the kid and their specific needs.
Of course.
But basically, it's about surrounding them with language, giving them tons of chances to hear it and use it in meaningful ways.
Like talking to them a lot, reading, singing.
Right, having conversations with them, but you also want to give them extra support where they're struggling.
So if a child has trouble pronouncing words, you work on specific sounds.
Yeah, or if they have trouble understanding what they hear, you might use visual aids.
So it's all about making it personal to that child.
It is, and it works best when families, educators, and speech therapists all work together.
Speaking of families, we were talking earlier about the parent empowerment model, how it focuses on supporting the whole family. Can you give an example of that?
Sure, let's say a family's worried because their 4-year-old isn't talking as much as other kids their age.
Right.
Instead of jumping right to testing and therapy, someone using the parent empowerment model would spend time getting to know the family.
Like understanding their culture, their ideas about how kids develop.
Yeah, and what their goals are for their child. They might even watch the child interacting with their family at home.
To see how they communicate naturally.
Exactly. And then, based on all that, they work together with the family to come up with a plan.
So maybe it's not about sending the kid to therapy right away.
Maybe it could be about giving parents tools to create a richer language environment at home, or connecting them with resources in their community,
It's about making parents feel like they can handle it.
and reminding them that they know their kid best.
I like that a lot. It's way more respectful than how it used to be.
Yeah, it really values the parent's knowledge and experience.
And research shows that when families are involved, kids make more progress.
Definitely. Okay, so we've talked about the importance of looking at the whole child, their environment, being sensitive to their culture, and empowering their families.
What else should people keep in mind about preschool assessment?
Well, it shouldn't just be a one-time thing. It needs to be ongoing.
Because kids are constantly changing.
Exactly. So you got to be regularly observing them, talking to families, getting information from different sources.
And being willing to switch things up if something isn't working.
Right. It's all about finding what helps each child learn and grow.
Not about labeling them or limiting them in any way.
Absolutely. And our deep dive also brought up some ethical stuff around assessment.
Like how we use labels.
Yes, labels can be useful sometimes, but you got to be careful.
Because they can become self-fulfilling prophecies. Like if you label a kid as having a language delay, you might start expecting less from them.
And that could limit their chances to learn.
We have to remember that every child is different, and labels don't tell the whole story.
Right. We also got to watch out for bias in our assessments.
Yeah, making sure they're culturally sensitive and fair to all kids.
Exactly. Like those standardized tests we talked about. They might not be fair to kids from certain backgrounds.
We always have to be checking our assumptions and making sure we're being equitable.
Absolutely.
Wow, this is giving me a lot to think about.
Me too.
I think we should wrap up this part here and continue in part 3.
Sounds good.
So we've really dug deep into this topic of preschool assessment.
Yeah, we have.
And, it's made me realize there are just so many people involved in this process. The kids, the families, the educators, the specialists.
It really does take a village.
It does. And when everyone works together, I think that's when you can really make a difference.
Absolutely. Everyone has something valuable to contribute.
It's also been really interesting to see how much our understanding of early childhood development has changed.
It has. We're moving away from these rigid ideas about assessment.
Right. It's not one size fits all anymore.
Exactly. Every child is an individual, and we need to recognize that.
And at the end of the day, assessment is really just a tool, right? It's about helping us understand these kids better so we can support them.
It should always be about the child's well-being.
So as we wrap up this deep dive, what would you say are the most important takeaways for our listeners?
Well, I think the biggest thing is to remember that assessment should be about the whole child.
Not just their academics.
Right. Their social skills, their emotional development, their physical development, their creativity.
And remembering that kids develop at their own pace.
Yes, some kids are early bloomers, some kids take a little longer.
And that's okay.
Absolutely. We need to make sure our assessments are inclusive and celebrate all those differences.
And of course, we can't forget about families.
Never. They're the experts on their kids.
And their voices need to be heard.
When we work together with families, that's when we can create the best learning environments for all children.
Well, this has been a truly fascinating deep dive, I have to say.
It has.
I've learned so much, and I hope our listeners have too.
Me too.
And remember, assessment is a powerful tool, but it's up to us to use it in a way that benefits all children.
Absolutely.
Thanks for joining us on this deep dive into the world of preschool assessment. We'll see you next time.
Bye, everyone.